Tried to weigh me down, crabs in a barrel. Wanna take my crown, renegade. I'm lighting up the way, I'm inspired. On the trail. Hello, hello, hello. Welcome to the Power Table, conversations for Black women. I am excited about the second season. We are bringing you Black women throughout the state who are going to share their brilliance, their beauty, about the issues that are important to us and about us. So sit back, stay tuned, and enjoy the show. Thank you for joining us today for the Power Table. We are so excited to be here. We're so excited to have our in-studio guest, Adjoa Jones. Yes. And listen, we have been, walking in the same space and almost like sliding glass doors, never necessarily touching.
Right.
But you are just like instrumental in the work that's happening here in Los Angeles around Black maternal health. And so I just wanted to bring you in. I think that there's never too much work that we can do on this subject, because years ago we did the State of Black California report when I worked for then Assembly Member Karen Bass. Okay. And that was the first time I saw that our maternal mortality rate was that of a third world country.
Yeah.
And that's been, almost over 15 years.
Yeah.
And we're still fighting that fight. So first, welcome.
Thank you.
And then let's get into it. So first, let's just talk a little bit about yourself.
Well, first, Kelly, I want to thank you for inviting me. And you're right, we were sliding in and passing through, and I've been watching and participating in some of the dynamic work you've been doing, and definitely a part of the California Black Women's Collective, being in the Facebook groups and just following the emails and action and engagement. So super excited about that and the report, which was dynamic and, vital for our California and Black California, really, especially Black women and girls. And I never leave out our men and brothers, young folk. So I'm a lifetime resident of Los Angeles, California, was born and raised here. And my parents were what I would call revolutionaries or activists. They went to Cal State Northridge and were instrumental, my dad and some of his friends, in getting the Pan-African Studies department there. I guess it's been about 60 years now since that happened. And so I just been brought up in a community that has really been centered on the work of empowerment for Black folks, especially in LA County. I was probably part of the first class at Marcus Garvey. And so they were instrumental there too, along with their friends. And so this work is near and dear to me, being a former teen mom and having support. So I always had familial support. My family was there for me. And so it was critical for me. I took the opportunity to go and stay at St. Anne's maternity home. When I was in high school, I was at St. Mary's, and I was like, I don't want to stay at home. Both my parents had remarried. I was like, I want to get away for a moment as I transition into motherhood, which I didn't feel like I was ready for, because I was on my trajectory, like, I'm going to Spelman, and and life happens. And so I got there and I saw a number of young people who did not have the support, because at the time you were like teen to young adult. And I saw an 11-year-old young lady, who the child's father was double her age. I saw a blind young lady. I saw a deaf and hard of hearing. And then I saw just your average teen, but who lacked familial support. And so I said, I know at some point I really want to get involved in that. I thought I'd be a doctor, pediatrician, and HIV and AIDS was happening. And I said, no, I don't want to see any babies dying, because then, it was really life and death. And so somebody brought this up. You never thought that you lived through pandemics or epidemics, and you have. And so the HIV and AIDS, and then COVID. Right. And so for me, I had gotten in this work as a college student. I was at Cal State Dominguez and met a nurse while I was a student worker with the county. And she was like, I think you'd be great for this program we're starting called Great Beginnings for Black Babies, with Zola Jones, who was a nurse with the county and who had branched out and decided to start her own nonprofit. And that was Inglewood Healthy Mothers and Babies, and it was a partnership with Daniel Freeman. And I went over there, started there with them, and really enjoyed the work of community health work and perinatal health education. So that's how I got started. Stayed in and around the county in public health for about 25, 26 years. But about 6 years ago, I saw that looking at public health and looking where we were with Black infant mortality and morbidity, and seeing the rise of learning now that social media is present, and you can Google this and you can Google that, and you would see more things prevalent. And there was a documentary called Death While I think it's Death. I gotta look it up, but it was an Indian student wrote it. I want to say it's Death by Delivery. I got to look up the documentary. Anyway, it talked about Black birthing and the poor outcomes in New York, in Atlanta, and I was traumatized. Like, my friend Jan at Black Women for Wellness, we were like, wait a minute. And yeah, it was Death by Delivery. And I was like, okay, we have to do something different. LA County, we have not reduced Black infant mortality even by a halfway point. We're not doing this well. So how can we do this and bring community? And so at a time, I had stopped grad school for a few years, and I was like, this is what I was going to do my paper on, so I might as well think of how I can do it with this community. And that's what it is. It's just bringing community and government together in a partnership to look at what are the gaps in resources and services and what can we do about it as a community.
So when you think about, like, I remember that California was the worst in the country about 2 decades ago. And now California is considered one of the best.
Yeah.
But the disparity gap has not changed.
The disparity gap has not changed. We're not at worst like Denise Pines and Monique Matthews and I don't know why it's Olympic champion, it'll come to me. Felix is her last name. Put together Birthing Justice, right? And when they went around to different states, I never realized how they were just their rates were even worse than what I imagined. I only knew about really New York and Georgia. But then when I saw D.C. had the highest, and then we're still less than them, I thought, okay, we're doing something well, but across the nation, we're not doing something well. And so how do we, even though we're here in LA County, and people think that we're such a progressive state, right?
Absolutely, absolutely.
Until you get down to the specifics of issues like this, where it comes to housing insecurity, food insecurity, just the mere fact of pregnancy and birthing, we're not even afforded the respect and decency in that. And so, yeah, it seemed like we were doing even much better, but when we started, we were saying Black women were dying at 3 to 4 times the rate of white women. And then March of Dimes, along with, I want to say it was CMQCC, did a report on and looked at the data and found out actually it was 4 to 6 times the rate of white women that Black women were dying in pregnancy and birthing.
That's so sad.
Yeah.
So sad.
Yeah.
Right, because those are lives, right?
Yeah,
those are lives. And so when we start talking about our population and everything, it's like all that feeds into, well, the reason, a lot of times we're like, well, we're not surviving. We're not surviving from a lot of things, whether when it's coming from chronic disease or maternal or infant mortality. What do you think we can do different to be able to finally move that needle and change the trajectory of Black birth outcomes?
We have to be advocates. We have to not, push things under the rug, act like they don't exist, say racism and bias is not. That's not really what's happening to Black women and girls now. That's not what's happening to Black dads. I will say this. In the last year since we lost Mrs. Bridget Cromer in March of 2023 and April Valentine, young woman, in January of 2023, getting to know and meeting their partners and family, has brought me into this even in a different light than what I imagined, that we do not listen to black women like we should. We do not listen to black men, the dads and partners, like we should, or even bring them fully into the conversation because they're a part of it. I mean, just the reality is this: no one, no woman, no matter what our person, no matter what your orientation is getting pregnant without a male seed. That's just the reality. And so that means that we have to be open to the dialogue. We have to have partnerships with clinicians and healthcare plans that say, listen, we cannot continue in this vein, because actually we're finding out that the costs associated with babies in a NICU, associated with those that have long-term birth defects and abnormalities, is so it's
very
it's
expensive.
insurmountable, the amount. It costs billions of dollars. That if we just took the time for prevention, for education, to be better advocates, make space for people making complaints, and then also looking at the fact that maybe some physicians or nurses just can't continue in that vein if you have so many complaints against you, or you have so many issues that have shown up. We've gone to the medical review board, and we've heard families crying out about having 2 separate generations be impacted in basically lives lost at the hands of a same doctor. And so that was up in Kern County, and so that's horrible.
Yeah. And there is the reality that it doesn't matter where you are in California. The birth outcomes are for black. There's a disparity gap.
There's a disparity. The other thing I think we have to make a point of is not making a difference for black women and girls on what your socioeconomic status is.
Absolutely.
Meaning what your income levels are, because that is not our reality. Actually, black women who have higher degrees and say you have multiple degrees, doctors and lawyers and nurses, and those that just have any advanced degree, fare worse than white women who have not completed high school.
Right, absolutely. I mean, I know my birth journey with both my sons were I remember particularly with my youngest son, I was so sick through that whole journey, but just the way in which the doctors treated me when I would go into emergency because I was throwing up blood or, and saying, well, maybe you shouldn't have this baby. You already have one. Like it wasn't even a matter of being empathetic and do no harm was not in the cards at all. Thankfully, I was like, I'm going to, do this and we're going to have this. And even after birth, having, hemorrhaging right after birth, luckily I was in the hospital and I wasn't home because they had kept me longer.
Right.
And because of some of the complications I had during birth. But when you think about like women who do go through traumatic like birthing experiences or pregnancy experience, what resources are there for them to deal with the mental health component?
I'm glad you asked that. We learned a lot of things really within the last year. We thought, we have our mental health partners, right, that are a part of our network, and that was sufficient enough, like Open Paths Counseling or Maternal Mental Health Now, and some other practitioners. But we found that we were not really getting to the more silent folks, those that had losses, like maybe had a miscarriage or several miscarriages. Maybe they had stillbirths. And when you think even about a stillbirth, you have to think about the fact that somebody has already most likely named their baby.
Right.
They've had a baby shower. Right. They have all those items they've planned for taking off.
Right.
And a lot of times they have had to actually wait to, they're like to be scheduled to deliver a baby that has already passed. And so I think about the young lady who just died at 40 years old in another state, the former Kansas cheerleader.
Yes.
That,
yes.
Her and her husband, I'm sure, grieving their loss of their baby, only to turn around and for her sepsis to not be properly diagnosed and identified, and then she passes away, right? And you have people who are so insensitive that are like, well, she was 40. That don't have nothing to do with it. It's people in their 50s having babies and still making it, and those babies don't have birth defects specifically.
Right.
It's about proper care, proper, proper thought to each person's situation, proper thoughts to the dads, right, who have also experienced that, right? Having the conversation and making mental health available in our community. I'm glad for some of our partners who have we were able to do capacity building trainings last year to offer to providers about Black maternal and paternal mental health.
Right.
Also to offer to our community, right? Because the grandparents have said nobody thinks about us.
True.
And so to open it up to the community at large and those that are part of the village to say, listen, we need to talk about our Black emotional well-being.
Right.
And so we did 2 sessions on that. We even had one mom who was probably maybe 24 to 48 hours out of delivery, laying up with the baby swaddled next to her, listening to these sessions in a whole nother state because we were able to go virtual. So we have started to dig deep, thankful to our Board of Supervisors who brought a proclamation last year to deal with the losses for those who have been impacted by stillbirths and miscarriages and the premature loss of their infants. And so that's what we're working on.
Right.
How do we create that? I'm thankful to one of our doula clients, our AIM doula clients, who brought it up, who, experienced the loss, and she said, hey, I'm not happy with this outcome. I'm not happy. I feel like I could have been better served. And there are some folks that she did get some service from. I'm trying to think of the group, it'll come to me. That is a part of our AIM Village Fund grantees that also served her. But there's others that we're like, okay, there's a NICU support group now.
Right. That's wonderful.
So,
So, we've been talking about protecting Black women and girls, and particularly, this is critical, right? If there's no healthy start, there's no positive outcome long term. So when we're talking about, we're actually having discussions about a 50-year plan.
Right.
So if you look at, and not 5, not a 7, not a 10, but a 50-year plan, and we've been saying, what do we want Black women to experience? If we have a 50-year plan and we say we want Black women to be thriving in 50 years, what does that look like for maternal health?
Well, first of all, let me just say thank you for the fact about the 50-year. Because when I first started and had this conversation with our former Health Promotion Bureau Chief, Dr. Allen, who worked directly with Dr. Ferrer, I would start talking about the sustainability of this. And our conversation that we would introduce folks to is dealing with Black infant and maternal health and the racism and bias that has impacted not just LA County, but even broader, and going back to folks like Dr. J. Marion Sims and his egregious acts against 3 slave women, Betsy, Lucy, and Arca. And really talking about what has happened to the descendants of the African slave here for over 400 years. So if this has happened for over 400 years, you can't solve the problem in 5 years, 10 years. We need a long-term plan. And so when you look at maternal health, we need to just even the playing field about how medical schools, institutions are teaching future doctors and nurses the facts that they had in those books, that we have thicker skin, we have a higher tolerance for pain. I mean, we had to survive. We didn't have no higher tolerance of pain. I mean, anybody who get whipped, I don't know that it's just like feels good at all. We had to continue to bear it. You get our elders, our ancestors were whipped and still sent out to the field. So what were they supposed to do? They were supposed to just lay down and die, or do they continue on for their family members or for their children? Are for the greater good, and nothing about slavery was good. I don't care how these folks paint the picture and lie about it, because they weren't even there and they haven't experienced it themselves. But I'm thinking to a post I saw on X last night from attorney Ben Crump, and he was showing the high rates of maternal mortality in Ohio and the egregious comments that were made by ignorant folk. And when I say ignorant, it's because you lack knowledge, and the truth is what it is, and that's why they want to erase our history. And so the reality is that we're going to need safe birthing spaces, bring back midwives, and more institutions to train midwives. And I shouldn't say bring back. There's been black midwives still practicing. But the practice of midwifery has not shown us that it's unsafe, as folks would like to project, make it appear that it's unsafe. We have Kindred Space here. They're expanding. They started in South LA. They're about to expand to Antelope Valley.
Wonderful.
We have our Charles Drew Black Maternal Health Center of Excellence. They got a $9 million HRSA grant for 5 years to open up more maternity homes or birthing spaces. We have to look at being realistic and having doctors really hear from women and really be able to get down and have these conversations that explain what's medically necessary and what is not. How is it that some hospitals are able to reduce their C-section rates and others are not? Are you really prepared to teach us, if they have a C-section, what are some of the things that you need to get to an emergency right away? Or you need to have somebody coming in to better care for you, or at least help you, take your blood pressure. If you're getting your swollen ankles or your legs are swelling up, you need to get to the hospital. But stop ignoring our claims and our making them as claims instead of, this is a reality. This is my body. I know what my body feels like when it's good or when it's bad.
Absolutely.
I would expect the same of you. I finally say this part. When I talk to physicians or clinicians, I talk about the fact that your oath that you have to take to become a provider, it has nothing to do with the color of a person's skin. It has something to do with you providing care to human beings. And we expect that, because here's a point where we're most vulnerable. We show up, right? And we're showing up for care because you have taking all the, you have all the skills, is what we've been told, to be the one to serve me. So I expect you to do your job. Don't say that we don't come for services, because this is what they'll do. They'll say, oh, we have the services, but black folks don't show up. Well, let me tell you something.
That's right.
I'm not showing up anywhere where I'm going to be continually mistreated.
Absolutely.
Whether it's shopping,
right.
whether it's eating, wherever it is, we deserve the dignity and we deserve the respect just like anybody else does. And so that's part of the maternal health piece that we look at. The 50-year plan is dignity and respect in pregnancy and birthing. That's why our current supervisor, former Senator Holly Mitchell, put together SB 464. The same for SB 65 that made the expansion for doula services. And a lot of these acts, and guaranteed income, and a lot of these acts look at, those laws being implemented and enforced. So you got to do the training on implicit bias and racism. And it was supposed to be in person. COVID happened, and it kind of got away from the in-person. But the purpose of the in-person was to be able to do these in-person conversations, role-playing acts, and better understand. I'll share one last person, Dr. Candace Cole Kelly, who has about 70-page book on training providers around maternal health care and just health care in a hospital setting. Wow. Simply amazing. Working with Long Beach Miller Hospital on that, simply amazing. You got nurses that are really interested. Huntington Hospital is about to do rounds around black birthing and equity.
Right.
Yeah.
Right. Well, thank you so much. This is so important. How can other folks get information about the work that you guys are doing?
They can follow us on our Black Infants and Families social media pages. We're on X at BIF_LA. We're on Instagram, Black Infants and Families LA, and Facebook, Black Infants and Families Los Angeles. And finally, our website, www.blackinfantsandfamilies.org.
Thank you, thank you, thank you,
Thank you.
for committing to improve the lives of Black women and girls.
I'm
We
excited.
appreciate you taking your time to be with us here today.
Thank you.
Wow, wasn't that great? I hope you enjoyed the episode and you found it empowering. You can follow us on X, formerly known as Twitter, Facebook, Instagram, and our YouTube channel. Also, you can find out more information about the California Black Women's Collective Empowerment Institute at www.cablackwomen'scollective.org. See you next time.